The casualties of the pandemic go beyond the patients who are being treated. The collateral damage extends to the medical providers who are treating the patients. In his special report, investigative reporter Chris Horne shows us how their desire to heal people goes up against their own well-being.
It's continuous and intense. Seasoned healthcare professionals are having to come up with the rapid flow of COVID patients, and it's coming at a cost to their own mental and physical health.
It's been a marathon of stress.
I think I would be lying if I said that we aren't tired.
Going from room to room, literally, where people are passing, it's just this overwhelming grief.
You have this pit in your stomach, and because everyone is fighting for their lives.
Even for people accustomed and trained to deal with the sick and the dying, the relentless continuity of COVID is wearing them down.
Unfortunately, we're seeing a lot of deaths and a lot of serious illness.
And despite the vaccine, several more months of uncertainty.
The stress started back in March and April with the unknowns.
Centera counselor Michael Verano says healthcare workers are dealing with what he calls moral injury and complicated grief.
Feeling like I can't perform up to my standards, to my values.
All the major systems in Hampton Roads offer help to their providers on the front lines. And being who they are, they know some remedies of their own.
I have definitely changed my eating habits.
Mm-hmm.
I eat more foods with protein, fruits, water.
From a stress standpoint, I will say that I'm definitely exercising more than I did prior to the pandemic.
2 minutes out of my day, I'll go to the bathroom because that's where you won't get interrupted and play a song and just breathe and listen and recharge.
Virginia Senator Tim Kaine has introduced the Lorna Breen Act. It would dedicate anywhere from $50 to $100 million for mental health services at first, with ongoing funding after that. It's named in memory of the ER doctor and Charlottesville native who was so overworked and overwhelmed with COVID patients last year in New York City that she took her own life.
To make it easier for healthcare professionals to seek mental health assistance without worrying about, is it going to affect my job? Will it affect my license or credentials?
And I think it's understandable that those things can happen, and unfortunate that she didn't have the resources available to help combat it.
Coming up at 6, you'll hear the riveting accounts of 2 nurses who scaled the peaks of hope when their patients were able to survive, but then fell into the depths of despair when their patients passed. Chris Horne, 10 on your side.